So basically, there's no like formal need to have to do specialist like qualification training. I really encourage a lot of general dentists that are just interested in looking after special needs patients there's a lot of opportunities to just undertake specific CPD without needing to be formally qualified. And then I would encourage to reach out to someone that might be able to mentor you in and support you in looking after those patients so that you have that ongoing support, because dentistry is so practical. It's useful to have someone to look over cases with you or to discuss and bounce ideas off of.
In this second part episode with Dr. Trudy Lin, we dive into having an open mindset and avoiding specific expectations is critical in navigating the unpredictability of the specialist program and embracing unexpected opportunities. And we talk about overcoming imposter syndrome and self-limiting beliefs in pursuing leadership roles. And also the opportunities and challenges of being a specialist in a small and niche field, and the mindset needed to make a lasting impact. So I hope you enjoy.
CPD Junkie Dental Podcast is about connecting with passionate Australian dentists who are improving themselves and have attended various CPD courses. My aim is to find out for you the best CPD courses around and what they did to help get them to where they are today. So you can consider doing it and becoming the best dentist you can be quicker.
I mean, look, I totally agree. Like, if I could speak for my own experiences, that a lot of times when I was looking for courses, there were just all these weekend courses and there was no follow-up and there was no, like you said, I think for me, what that spoke out to me was accountability. There's, you know, there's nothing to keep you accountable to try to continue implementing it, or, give you some sort of feedback in terms of, is this kind of where you're heading? Does this work? And so I find that for myself, a lot of the courses I try to attend and apply for are those more longer term ones that they have some sort of community or network to kind of bounce back and then, continue that communication and accountability for.
Yeah.
Sorry, I guess my question is really like, how did COVID kind of impact special needs? Because special needs is so complex already. Like, did it add an extra layer that made it difficult? Like, how did you kind of travel through that particular time?
Yeah. So I guess the answer to that question would be around our patients who have like medical compromise, so who are immunosuppressed. There were a lot of challenges because they now had all this uncertainty around whether they were going to catch COVID. So, I mean, the way that I would answer this question is around the fact that it's more about holding all the emotional kind of challenges that they're going through at the same time, because they would come to us and our role is to help them with their oral health care. But then as a specialist in special needs dentistry, I really believe that we're not here to look after teeth, but we're here to look after people. And so sometimes it's not about us actually getting the procedure done, but it's actually about holding space for that person to now speak to someone that's in the system who has a little bit of extra time that their medical professionals might not have, to then let them share their worries and their concerns and uncertainty about the future and what the future looks like in the context of COVID, and how they could step outside and then, catch COVID and not actually make it to the end of their chemotherapy journey, that kind of thing, which a lot of other people may not understand, but we understand, being a, oral healthcare clinician that has that extra knowledge around the medical complexities that they're going through. So I would say that was like the big layer that was added on top of it, was actually the holding the emotions and holding the space to help our patients work through those emotional challenges, which I think is integral to our role, because we're here to look after people and not just do the dental procedures that they need.
Yeah. I want to ask another question, which is, there's so many advances in dentistry nowadays, right? Is there any aspect of that advancement you seeing being implemented with special needs? Digital dentistry, stuff like that, has that complemented or helped assist in your ability to provide services for special needs?
Do you have any examples?
I mean, like, for example, like printing, milling, diagnostic models, all that, those technological
Okay.
advances, has that kind of helped assist your ability to provide treatment for special needs student
Yeah,
patients?
so this is very niche, but basically one of the really significant things that has occurred is that we have a lot of head and neck cancer patients that might have surgery to their palate or their face that ends up meaning that they can't have a typical denture because they might have a hole in their palate that communicates with their nose. And so what we can create as a specialist is this device called an obturator. So it looks like a denture, but it's also got like an additional aspect on top of it, which is designed to plug up that communication so that they can still eat and speak without food coming out of their nose. So one of the challenges that we face with creating obturators is that, as you can imagine, is extremely uncomfortable and can be even traumatic for patients that have just undergone a major head and neck cancer surgery and now experiencing the ulceration and the symptoms of radiotherapy and all that, to then have impressions done inside their mouth so that we can make an obturator. And so there are ways that we've in the past worked around that in terms of we'll take impressions like before they undergo their surgery, and then like the technician does their work and try to estimate things. We use certain types of materials which try to reduce the amount of time that it spends in their mouth. But there are certain patients where their mouth opening is so little that it's almost impossible and very challenging to get the like a good quality outcome with like the impression. So one of the advances of the intraoral scanning techniques that have come along have meant that we're moving into the space, we're going to try and use that to create obturators for our patients. There are still a few things that we need to work out in terms of how we get the detail around the 3D effect of when it goes up into their nasal cavity and things like that. But if we can manage to work that out, that will make a huge difference to these patients. For them to not have to undertake an impression. So the impression material that we need to use, it needs to be very flexible, of course, because otherwise if it goes up into an undercut in the nose, you can't exactly pull it out if it's like, Improgum or something like that. So the one that we use, actually, it takes about 12 minutes to set. And so if we were able to use the intraoral scanning techniques and get it to a standard where we can create the obturator based on that and save them from having to undertake that secondary impression, that would make a huge difference to the experience of patients who require an obturator after surgery.
Yeah, maybe, I mean, because obviously there's a lot of all-in-4 cases and stuff like that, or people who are doing like digital dentures as well. So maybe somewhere down the path in the future, when the scanners get really good, they can, have a better depth of field that they'll be able to kind of create something like that. So yeah, when you graduate out of the specialist program, does it differ to what you expected, to what you thought was going to happen, and to actually what happened, if that makes sense?
So I think the thing is, this is part of like my mindset training, is that it's better not to have too many expectations, because when you have expectations, then you're kind of setting yourself up to then be disappointed when they're not met. So I've always found that adopting this very open mindset of being open to whatever experience comes my way has been really helpful, because there is so much like unpredictability that comes with the day-to-day of being a healthcare professional, not just a dental clinician, but just someone that exists in a health profession. But then you add that extra layer of, we're looking after patients that are very vulnerable to, having additional complications like medically. They have like additional barriers that they're facing to access care in the special needs dentistry umbrella. It means that there's just so much which can be like very different to what you expect, that it's important to not have particular expectations about how things will go. So one of the things that dismantled like this idea that I had around expectations was that I had kind of had carried this expectation that, okay, when you become a specialist, what you should do is to then just spend some time, you know, just building up your clinical skills as a specialist and things like that. And then once you've had, like, let's say 5 years doing that, you can then consider potentially stepping up and doing research and doing lecturing or advocacy and being on committees and things like that, being in formal leadership positions. So that's what I was kind of taught, like, and got messages about that from different like people that I come across in the dental industry. And then very unexpectedly this was in 2021. Yes. So a year after I had formally become a specialist, I was nominated to become the president elect, which is the incoming president for the Academy of Specialists and Special Needs Dentistry across Australia and New Zealand. And because I had this, you know, kind of like unconscious expectation that, wait a minute, you don't do those things until you're at least like, you know, been a specialist for, you know, 5 years. The thing is, I immediately my first reaction was to reject it and say, no, I don't want to take up this opportunity, because all this imposter syndrome, expecting that, okay, these things, you're not ready for this until you've been a clinician for a certain number of years, which when you look at it, it's like, well, that's not actually, all of those things are all just, you know, self-limiting beliefs and thoughts. They're not actually objective truth. But then through working through it, again, using like mindset and also getting perspectives from other people, you realize that actually there are a lot of barriers that you can overcome, and you don't necessarily need to, like, I guess, go by what the narrative is that's being said around you. Like, who said and who made the rule that you have to have been a clinician for this many years as a specialist before you can then apply for this role or be nominated for this role? You know, the president had seen the advocacy that I'd done on a, you know, smaller level to what I do these days, but had seen that skill set and that passion and that drive in me during some of the presentations I gave, like case presentations I gave during my specialist training. And he said, that's the number of years of clinical experience you've had as a specialist has got nothing to do with whether you're going to be a great advocate or a great leader and be able to inspire the next generation of specialists to then want to engage in this work as well. And he said, that's what's important for this leadership role and to be the president of the academy. It's not got nothing to do with, you know, how many years you've been a clinician, but actually what skill set you bring, the energy you bring, and the passion that you have for this work, and to continue this. And so I did. So I guess that, yeah, that's why this comes up when you ask that question around, what things didn't match my expectations. If I were to say, I would have not expected that kind of opportunity would come to me, like, you know, just a year after specialization training. So, you know, to all of your listeners out there who are in that, maybe in a period where they think, okay, I need a bit more experience or more years of training before I can do this or step up into this role or explore things outside of what I do as a clinician, I would say just really carefully question that thought and really think, you know, is this actually true? And, you know, choose for yourself and like your reasons about whether you decide to delay it or a year. And if it's because you're afraid of, you know, these self-limiting beliefs that might be imposed on you unconsciously, just have a really good look at that and decide whether that is a reason that you like. And if not, then, you know, take the leap and actually go out there, because you never know what kind of impact that might have. So just by being an example of what is possible, you know, by you stepping into a position and being younger than what people expect, that's going to break the mold for future generations. So then later on, people then can break down that expectation that I was holding, which was that you need to have a certain number of years. Well, now, hopefully, we'll have incoming presidents that aren't necessarily, you know, the same age demographic that they were before I stepped into the role. And so, you know, just by you deciding to overcome a narrative that you don't necessarily agree with can actually make a big impact that you don't actually, it's hard to like understand until you actually do it.
Yeah, no, I think I understand what you're trying to say, because I think for a listener listening in, right, you're at this point, you're in your mid-20s, right? At this point. So it's like,
No, I'm 30.
sorry, okay, so you're 30 at this point, right? But a lot of the people that you might have been looking up to at this point, or thinking that should be sitting in this position, like you said, are probably in their 40s or 50s, where they've had many
They're in
years
their 50s.
in it. So you're thinking like, that's me, like people are really looking at me to be an example for the specialists. So, I mean, which kind of leads me to the next point, which is who's been pivotal in your career path and why? I mean, you mentioned that there was a life coach. You mentioned that, you know, someone who kind of encouraged you to take on this presidency role as well. You know, is there anyone in particular or group of people that you would say is being pivotal in your career path, and why?
Yeah, so definitely my first like coach, leadership coach, Dr. David Holden. He was a palliative care physician as well, or still is actually. And so that his experience in that area, and as a specialist in special needs dentistry, I look after people who are undergoing palliative care. He was a significant role model, and also being my coach helped me cement and figure out for myself that that was the career I wanted to go on. And then I would say, in terms of groups of people, the academy that I'm now a part of, and stepping into that presidency role, because we're such a small specialty, there's only 25 like specialists in Australia, and we also have like the New Zealand specialists who are part of that academy. Just being able to connect with very like-minded clinicians and people that have undertaken the same journey as you, so understand the rigor of postgraduate training, and also understand the additional complexities, not just to providing clinical care for these patients, but also some of the heavy emotional things that you also need to carry for your patients as well. That is something that's extremely valuable, and something that has really helped me get through a lot of really challenging times. Yeah, as I alluded to before, like one of the things that made me hesitate and had a bit of like self-doubt around whether I could become a specialist, which my leadership coach, Dr. Holden, helped me work through, was around the fact that I knew that I have a personality type where I tend to get attached to patients and find that emotional side of things quite challenging. And that this was an inherent part of my personality, and it's not something that I wanted to get rid of either, because I could see that that was a big strength. It was one of the reasons why my patients really trusted me, and we were able to get really great outcomes for patients, because built upon that trust, because they knew that I had their best interests at heart. But that had that double-sided effect of, well, you know, the more that you care about your patients, the more it hurts, like when they pass away. And that happens a lot in the line of work that I do. So I was really hesitant and had a lot of self-doubt around whether I would be able to manage that emotional side of things and losing patients that you really grow attached to and care about over the course of a really long career. And so having that group of specialists that understand those challenges and can, you know, hold compassion for you and like let you debrief and discuss like, you know, these things and hold that for you is like really significant. So I would say that that has been really pivotal and a really important part of how I can do the work that I do these days.
Yeah, but my thought is like, you know, when you're a specialist, when you come out, I mean, do you go out thinking, okay, I'll just do it solo, or do I go and team up with another group of specialists so then we can kind of learn from each other or build from each other or something like that? I don't know.
Yeah, so I guess in special needs dentistry, being such a small and niche field, it's not impossible to then team up with another specialist, but it means that if we do that, it's going to mean that we're more concentrated demographically in one area. So it means that there are less patients that have access to us, because we'll be all concentrated in, let's say, for example, in South Australia, the dental hospital, majority of the specialists work there. And so it means that if there are patients that are, really far out from that area, it makes it more difficult for them to be able to access our services. And so definitely, like as a newly graduated specialist, I did start like in the hospital and continue working as a specialist in the hospital because it's what was comfortable. It's what was easy. I had like all these specialists around me that I, got along really well with and had that access to support constantly. Yeah, it would have been much easier to continue the rest of my career in that same safe space. But then, when I thought about, the reason why I went into this field is because I'm passionate about creating that equitable access, because every person deserves access to care, then this doesn't align with where, I want to see our profession go. So it means that, yes, it's going to be more challenging to then step out and, start my own thing and be the one specialist in the current practice that I'm working in. So I'm part of a mobile dental service, again, aligning with my passion for making sure every person can access care. There are a lot of people out there that can't physically access a typical dental clinic and are excluded from being able to be seen at the hospital. So if I continue to work at the hospital where all the other specialists are, it means that there is this whole catchment of people that we'll never, ever get to, look after and provide care for unless someone decides to step out and do it on their own. And so those are the kind of things that kind of drove me to then decide, what, I am going to step out of that hospital role that's comfortable and safe and easy, and then go and do the hard thing. But know that when you do hard things, the reward is also greater as well. The impact that you make now. So us being able to go out there and provide access to care for people who have dementia, people who have autism and find it extremely stressful to go out into a hospital environment. That has been a really rewarding part of my work. And even though it's been challenging, the thing is, it's also the way that, because I made a conscious decision around this is the impact I want to make, it makes it a lot easier. And the thing is, even though I no longer work at that hospital, I still have like my colleagues, like, and all the relationships that I've built there, and they're still just a phone call away. And so that's a great thing about being able to connect with other specialists in your field, is that even though you might not be working in the same practice or necessarily seeing exactly the same patient group, you can always still draw upon that network to help give you support, like even though it might not physically be there in the same practice as you.
Yeah, wow. I mean, this just brings me back to a quote that when I was reading about you, which is, one of the things that, your grandma taught you was that the strength comes from not what you do, but it comes from overcoming what you once thought you couldn't.
Yes.
I think
that's definitely been a theme of my entire kind of career journey so far, and also my personal journey. It's one of the reasons why I ran the ultra marathon. It wasn't about just doing it for the sake of doing it, but it was for raising awareness for my cause, which is the Cancer Council, and also showing myself that, hey, you can do something that you never thought that you could do. So I picked running because in primary school, I was so short, still short. So, I don't have the stature to be a runner. And I just always had this belief I'm not a runner. I'm not good at running. That's for tall people. That's for people that are, more athletic. But my grandma kind of instilled in me this mindset of saying, well, it's actually, in order to become more of the person you want to be, it's about actually pushing yourself and doing those things that you never thought you could do. And so, yeah, there's no way that Trudy from back then would have thought that she could run one day, run a 105-kilometer ultramarathon. And the reason why I decided to do the ultramarathon too was because, as you know, I was doing the mindset coaching stuff at the same time. And it was a way that I applied what I was learning in the mindset coaching course into my personal life, not just my professional life, was that in order to get up on those days where it was cold and raining and dark, because the only way I could fit in my long runs and my training was by waking up and doing it before work, because I knew that after work, I would have all this patient admin and things that I would like would take up my evening. So I would be waking up at 4 in the morning and then doing my run before I get to work in the morning. And you know, the thing is, people ask like how you did it, and it's literally the way I did it was just managing my mind, like just remembering my reasons why. You know, the reason why I want to do this is to help, you know, raise awareness around like the importance of what I was doing was raising money for the Cancer Council, and specifically for cancer patients that were living in rural areas and couldn't afford the travel costs to come to the hospital to then be able to receive basically the life-saving treatment that they needed. And so I decided that even if I were to fail and not be able to complete the race, that wasn't what mattered. What mattered was that I stepped outside my comfort zone, did something that I never thought I could even attempt to do. And then in being that example, be able to inspire other people to then raise awareness and then maybe try running for themselves, which happened. A lot of people in the hospital actually started picking up running after they saw what I had managed to do, and then start those conversations around, hey, this is this cause that Trudy was running for. How can we make a difference, whether that be a donation or even just spreading the word about the important work that the Cancer Council does. So yeah, it was like a really, my grandma has been a really big influence on me. And even though she's passed away, the thing is, I can see how, you know, she's no longer physically here, but she still has so much impact and is making an impact on me and so many other people that I am now helping years after she's no longer physically here with us. And that's one of the ways in which I've managed to, you know, I talked about earlier the emotional side of things and how challenging it is when patients pass away, that I've been looking after. And I've applied that same kind of belief system to when my patients pass away. I think about how in the same way that my grandma's no longer physically here, they're no longer physically here, but I'm going to make them live on in the work that I do, in everything I learned through looking after this person I'm no longer looking after. I'm going to use what I've learned to become a better clinician, and they're going to continue to have a important impact on the people that I look after in the future. So this is one of the ways in which I can manage like the sadness that comes with losing patients that I look after on a day-to-day basis.
Yeah. And I mean, I understand that family is a huge important value in your life, because I mean, was it this ultra marathon that you had an interesting story where your family came out to support you?
Yes, yeah. So basically I had run, I think it was up to I was over the 80K mark. So there is a like rest stop every 20 Ks along the trail that I was doing. And so I had reached the last rest stop, and I had a tracker on me since the beginning. So my family were all tracking me through the whole day, and they saw that now that it was dark and I was running overnight and I hadn't slept, they saw that my pace had really slowed down a lot. And so what they did was they actually tracked me down and found me on the trail in that last 20K stretch. And they came and did the last 20Ks with me. And one of the things that I had decided ahead of time, I knew that in that last 20Ks would be the most challenging part. So I'd asked my support crew, please put this on my arm, like when I look like I'm just, you know, about to break and like can't keep going. And so after my family came, it was not long after that we did 10Ks together. And then my support crew person put this on my arm, and basically it was this tape, and I had written the names of every single patient that I'd looked after who had passed away. And that's what renewed my sense of like energy to keep going. Was I remembered, this is the reason why. This is why I'm putting myself through this pain. This is why I set this goal in the first place. And this is why I'm going to make it to the finish line for all these people. And my grandma's name was on there as well. So that whole experience really showed me like how important, like, you know, it all comes back down to mindset. Knowing your why and the reasons why you do something can help you overcome like enormous challenges that you might not even think is possible. And so, you know, to to anyone that's listening to this interview out here, I would say, you know, there's nothing special about me that doesn't mean that you could do the same thing as well. Like, I never thought that I'd be able to achieve the things that I have and done the things that I have in my career. And just by applying this skill set of really paying attention to what's going on like in your mind that might be holding you back, self-limiting beliefs, just let go of those, and you might be surprised of how much potential that's in you that can be tapped into as soon as you release that extra layer of self-doubt.
That's incredible. So look, people, I mean, as you alluded to, you're a mindset coach. A lot of people nowadays also talk about this hot word, work-life balance.
Yes. Yeah.
What's your hot take on it?
Yeah. So, yeah, I have some thoughts around that term of work-life balance, because I think people have different definitions of what that means to them. I think a lot of people have this idea in mind that it should be this perfect, like, you know, balance of, okay, every week I have this many hours that I'm at work, this many hours that I do my personal time, you know, that kind of thing. But I actually like to think of work-life balance more holistically in terms of your entire lifespan. So when you zoom out and you think of it that way, it means that you have this understanding that, okay, for example, if I apply it to my my specialist training, the thing is, if I were to look at the day-to-day of specialist training, there would be some days where I would not have that, you know, idea of balance, where I would have spent, you know, 10 hours at work and only 2 hours doing, you know, something personal that I would, for my personal life. But the thing is, if you zoom out and you think of work-life balance more holistically in terms of your entire life, the thing is, those extra 10 hours I spent, you know, most of those days during my specialist training, now it means that in this next phase of my life, I've got more balance in terms of right now I'm doing 3 days of clinical work and 2 days of non-clinical things. And that lack of balance that I had in those 3 years has now paid off and given me more balance in this period of my life. And the thing is, a lot of people, when they're zooming in and thinking of balance like on a day-to-day basis, that's when, again, if you set yourself up with this expectation that this is the way it's meant to be, then you add on this whole other layer of distress because things aren't what you expect it to be. Whereas if you're kind of going, okay, yeah, of course, I understand that there will be some days where I'm busier and some days where I'm not, then it means that when you do have a busy day, instead of being really, you know, upset and adding on this extra layer of, oh, you know, it didn't feel balanced today and it should be balanced, then at least you're letting go of that extra unnecessary like kind of suffering that actually doesn't help you get more balance and actually is just something that's self-created with your own mind.
Wow.
Yeah. So one of the concepts that I teach, it's called like the 50-50 concept, where it's actually about you have to have both the positive and the negative, or I actually don't like those terms as much anymore. And I talk about like uncomfortable and comfortable emotions. So it's kind of like when people talk about yin and yang, is you can only experience the highs of life when you also have the lows of life, because how would you know what happiness is unless you've experienced deep sadness as well? And so it's the same thing with work-life balance, in the way that, you know, we know that life will always be 50-50. There will always be that uncomfortable part and that comfortable part, and you need that contrast. Otherwise, how will you ever know when things are good and when things are bad? You need to have that as a reference point. So when you think about work-life balance, the thing is, you need to have those days where things are sometimes a bit more hectic, a bit more on that, like, you know, work side of things, in order to then later on, when you experience a day where you do get to spend a lot of time for yourself, that actually, you know, means something more to you. And it's something that you can get more fulfillment and more joy out of.
I think that's a great perspective at looking at it. So, I mean, there's so many questions, but let's dive into some of the guest questions that came up from when we were asking our audience. So Brendan wanted to know, what options are available for GDPs, general dentists, in extending their scope or special interest into special needs without specializing?
That's a great question. So basically there's no like formal need to have to do specialist like qualification training. I really encourage a lot of general dentists that are just interested in looking after special needs patients there's a lot of opportunities to just undertake specific CPD without needing to be formally qualified. And then I would encourage to reach out to someone that might be able to mentor you and support you in looking after those patients so that you have that ongoing support, because dentistry is so practical. It's useful to have someone to look over cases with you or to discuss and bounce ideas off of. There's a lot of specialists that would be more than happy to happy to mentor you and help give you that kind of support. And it's a matter of wherever you're based, like reaching out and looking them up. Because a lot of them that I know personally would be more than happy to help with any general dentist that's willing to get that extra experience. But if you are looking at formal qualifications that aren't at that specialist level, unfortunately, there's not that many opportunities available in Australia, but overseas, there are actually some shorter courses. So for example, there is a diploma in special care dentistry that you can undertake in the UK. And also there are certain fellowships that are available through the IADH, which is the International Association for Disability and Oral Health, and various colleges like in Ireland and things like that, where you can actually take a qualification that then allows you to then have the extra knowledge and confidence to look after people with special needs without actually having to be a registered specialist. So those are all things I encourage you to Google. You'll be able to find it quite easily. Another person's Say Teeth AU, I might be saying it like the way, it asks, is there a course that for OHTs can do to increase their skills with special needs patients? Interesting. So I'm not aware of any that are specific for OHTs, but I would say that, and this is one of the things that I do, is feel free to find courses that aren't necessarily made for dental professionals, because depending on what area of special needs dentistry that you're interested in, because it's very broad, but let's say your niche was you're really interested in looking after people with autism, for example. The thing is, you don't necessarily need to be Googling or trying to find like a, OHT course and looking after people with autism. You could very easily go to autism advocacy websites and find general courses that help you learn about that specific patient group, learn about autism as a condition, and then you'll be able to apply that knowledge and go, how can I apply this to the dental setting? So other things that I would recommend is looking up CPD that's actually tailored more for allied health professionals, for example, like speech pathologists or nutritionists and things like that, because a lot of the skill sets will actually apply into the dental realm. And then being a clinician, the thing is, you get to integrate your own knowledge and wisdom of how you can apply it to your specific patient. You just need to gain the knowledge, and it doesn't necessarily need to be from a dental specific course. So hopefully that's helpful, because that's something that I end up doing a lot as a specialist, because as you can imagine, once you've reached that specialist level, now I'm the person that's creating CPD for like a general dentist. So how do I get my CPD? I do that by actually looking outside of the dental realm, looking at CPD courses that are made for medical professionals, and then cross applying those skills into my own like clinical practice.
We got another question by, I might be pronouncing this wrong as well, Dave Etty. He was asking about currently provision of care to people with special needs are through government and hospital settings. What barriers are there for people in this cohort to private dentistry, and how can we reform or provide access to care beyond the government sectors?
That is a great question. Certainly, there are a lot of barriers that patients with special needs face. And we touched on part of it earlier around, this is one of the reasons why I've decided to step into the domiciliary or mobile dentistry space, because that's something that is being missed through just the public sector infrastructure at the moment, like ongoing continuity and care. I would say that in the private sector, one of the big barriers is the fact that seeing special needs patients generally will require a lot of extra time. Time with liaising with the medical professionals to find out their history and their background, talking to carers, and consent processes as well for those who have like cognitive conditions that lead them to then not be able to self-consent. So there is a lot of extra time required to look after these patients, and sometimes that doesn't fit into a typical private practice model where there are costs and overheads to meet, and productivity measures that are important to the practice owner. And so one of the ways in which I've tried to practically see if there's a way that we can help support private practitioners and be able to provide care is I've done this research thesis which looked at how we can improve access to care for people with disability. And one of the things that the UK has done is they developed this case mix tool, which acts as like a complexity or triaging tool, which can then help you to figure out what are the different aspects that create complexity for this person's care in this really structured framework. And then it can help inform your decision around, is this someone that's suitable to be seen in a general practice setting, or if they are in that level of complexity to be seen by a specialist. And the way that this helps in a private practice setting is that sometimes what takes additional time is not knowing what information to look for, or not knowing whether this is someone that should be referred off or is appropriate to be seen in that setting. So if you look up the tool, it's called the BDA Case Mix tool. And I published an article on it as well, which talks about the research I did on how it applies to an Australian context. And you start using that tool in your practice. The thing is, it can help you to then have this really structured and systematic way that you work through the complexities of seeing a patient. So it can make you more efficient, and it can also streamline your referral processes so that you're not stuck in that level of not knowing if this is a patient that's feasible to be seen in a general practice setting or should be sent to a specialist. But thank you. That's a great question.
So, I mean, those are most of the questions that we've got from the audience. And, just to kind of wrap it all up, I know there's been many gems you've kind of dropped along the way, but do you have any wise words of wisdom for the budding young dentist, or, key skills or attributes that they should start to continue to focus in on developing?
Yeah. So, because this is the one that's had the most impact on my journey, as they can probably hear through the whole interview, is that I think the most important skill that you can focus and learn is the skill of mind management. Because if you think about it, your thoughts and your brain is what's creating your reality. And so it makes sense to develop the skill of consciously managing what reality your brain is creating for you. And in fact, this is a skill set that I wish I had learned, like, the earlier you can learn it, the better. Like one day I have this vision that hopefully we can integrate this kind of skill set of self-coaching and coaching, which you can then apply to help your patients and also your team into like the dental curriculum, so that every dentist graduating already has this knowledge. But even so, we could go further beyond that and go, the earlier you learn it, even like in high school, it will be useful. So practical steps would be to start just becoming aware of what thoughts are running through your mind, and mindfulness is a really good way to start that process. And then consciously clean out the thoughts that aren't serving you, the things that I've already talked about, self-limiting beliefs, imposter syndrome. So like I like to use the analogy of mind hygiene, because being oral healthcare professionals, we all understand why daily oral hygiene is so important. You need to do it daily. And then if you do brush your teeth twice a day, then it can be a proactive strategy to prevent caries and gingivitis. Same thing, like mind hygiene done every day can help you prevent unfavorable mental states or burnout, and then also have the added effect of helping you access like the true potential that you have inside you if you were to get rid of all those unhelpful thoughts. And then the second attribute that I would say is very useful is, learn the skill set of coaching so that you can learn how to coach yourself, but then also coach your patients. And a really good one to start with is motivational interviewing. It's evidence-based. It's a type of coaching technique. It helps your patients get better long-term outcomes. And then also just think about how you can use it on your team members as well. So instead of telling your dental assistant what to do, see if you can use coaching techniques to help, and motivational interviewing basically, to help. Instead of telling them what to do, ask them questions and help them figure out how they can do things differently. When they do that, they're more likely to implement what they've learnt and what they've thought about, and you might actually get better, long-term outcomes together. So those would be my two kind of areas, would be work on mind management and learn the skill set of coaching so you can coach yourself, your patients, and your team.
I mean, whilst we're on it, what's an example of, a good mind hygiene? Because you mentioned like oral hygiene is brushing twice a day.
Yeah.
So what's something that's a good mind hygiene?
Yeah, sure. So what all of my clients I bring through my coaching program, I get them to do this, which is, so if they haven't had like a introduction to mindfulness and just becoming aware of their thoughts, then I would like look into just general mindfulness, like spending 5 minutes a day, just noticing what thoughts are in there without judgment. And then once you've had that, I actually ask my clients to do a thought download or a brain dump, like for 10 minutes every day. So basically what you do is you set a timer for 10 minutes, and then you just write whatever is on your mind onto a piece of paper. And then that in itself helps you to then have this separation of what's going on in your mind, and then seeing it on a piece of paper helps you have a more objective bird's eye view of what's going on. And then you go through each of those sentences, and then you decide, is this sentence actually serving me or hindering me? Is this sentence actually helping me get to where I want to go, or is it holding me back? And then just by doing that exercise, and if you do that every day consistently, you will notice really huge changes in the way that internal dialogue that is in your mind constantly. But, just becoming aware of it is a really important step. And then after that, if people are, there are some people that once they get that awareness, that in itself changes their entire life. But then there are people that want to take it that step further and actually actively change those thoughts. And that's something that I help my clients with.
Wow. Well, Dr. Trudy, I want to thank you for coming on the show today. If you could let the people know how they can find you or what's going on in your life.
Yeah, sure. So I have an advocacy website, trudysmile.net. So you can find me there. I'm also on social media, trudysmile.net for Instagram and Facebook and LinkedIn as well. Would love to connect with you there.
So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie Dental Podcast. Thank you.